The patient samples, which were slated to be sent to Carrefour for testing more than 2 weeks ago, have not been shipped out of the country as yet, according to Health Minister Dr. Frank Anthony, who provided an update on the COVID-19 situation on Friday. The samples are packed and ready to go, but the ministry is facing difficulties with sending the samples.
There are certain arrangements that have to be made. I think that is what has delayed the samples from going. But we have taken a decision. We'll be sending to 2 different centers. So some samples would now be going to the Pan American Health Organization. They have a lab in Panama. And the other set of samples would be going to Carrefour, to the lab in Trinidad. So hopefully we can get that done. And once that is done, I'm sure it would confirm that we have Omicron in Guyana.
The specialized testing known as gene sequencing, which is required to confirm the presence of Omicron, cannot be done at local laboratories. However, through a partnership with the Harvard T.C. Chan School of Medicine and the Ministry of Health, the National Reference Laboratory has been enabled to perform some levels of gene sequencing.
We'll start first with the Plasmodium falciparum. That's a malaria parasite. So they're doing work to sequence that particular parasite. But the same techniques can be used to sequence COVID-19. Now we are hopeful that maybe in another couple of months that we would be able to use the equipment that we have. We'll have to buy the kinds of reagents to make sure that we can sequence for COVID-19. But we are in the process of doing so.
The minister said based on clinical trends, local health experts are certain that Omicron is circulating in the country. Meanwhile, asked about the effectiveness of the drug baricitinib in treating persons with COVID-19 at the hospitals, the minister said the oral drug is making headway.
Such as baricitinib. And we have had very good results with it, with the patients that got baricitinib. We've been using it for the last 2 or 3 months at the Ocean View Hospital, and for most of the patients that would have received it, they got better outcomes.
In December, Guyana began using baricitinib, a pill which is highly recommended by the World Health Organization. Temika Rodney reporting for the HGB Nightly News.